how do you pick a traumatic moment? You know, a year in Afghanistan, 32 firefights, 10 friends that got killed. Which one was the one?
It doesn't matter what color you are a soldier. And so we don't ask for help. And that transitional phase is deadly if you don't prepare yourself.
So a lot of times our veterans, you know, they're out of the military. We've had lots of them tell us that they're at home looking out the Venetian blinds at the world go by.
And you start to become isolated and feeling like nobody understands you and you can't trust anybody.
You know, hey, I was fine. It was everybody else.
Yeah.
And that's the, you know, that's the issue with post-traumatic stress.
It got to the point where I had planned to commit suicide, and I did everything that the depressed person would do. I quit going out. I quit hanging out with people, let my grass grow in my house.
We got 22 veterans a day that are out killing themselves, and you know that's, I mean, it's a tragedy on so many different levels that you know, it's really not one that we can sit back and, you know, wait for this to occur.
The day that I was planning on doing it, I was sitting out there saying, you know, and something just came across my mind and said, what if you miss? What if it's not your time to go?
If you qualify for the full range of veteran services, it tends to be a fairly robust package.
They have VA mental health clinics that are outpatient clinics where you can go get clinical counseling, psychiatric services. They have inpatient centers for PTSD. They have inpatient centers for substance abuse. The services are there.
To qualify for mental health services, you have to have one of what we call the big three diagnoses.
Yeah.
Major depression, one of the schizoaffective disorders, or bipolar.
The VA, you know, they try very hard with the resources they have, and you know, within their purview, you know, they're pretty good at what they do.
Yeah.
But they miss a lot.
If service members, veterans, and families choose not to use VA services, or there's a barrier to VA services, transportation. If you've traveled this state, it's a big state.
Yeah.
And there's a lot of people that don't live near anything, much less a VA clinic.
Because when veterans come home, when they're making that transition, you know, there's usually a multitude of things that they're dealing with. You know, behavioral health may just be one piece of it.
When I look at the veteran who's drinking because he's PTSD, he's not drinking, in my opinion, because he's an alcoholic. I think they're self-medicating because of the PTSD.
Hardest to reach population, in my opinion, is going to be our homeless. Those who most likely have mental health issues and the most likely to not receive proper care.
Got a lot of local nonprofits that have kind of stepped in to fill the gap where there have been, you know, a need in services that aren't being met.
We're all nonprofits. We're all trying to help each other. We're all wanting to serve veterans. And, you know, my veteran may need your services. We do sessions with a licensed mental health professional, the equine specialist, the horse, and a client. It's just coming out to a safe, healthy, fun environment where it's other veterans. Most of our volunteers are veterans or family members of veterans.
I mean, there's all kinds of unique environments to put an individual in that then resonates with them to where they open, something shifts, some sort of healing can occur, some sort of opening can occur that then they can share something with somebody that then can then help them process that, you know, whatever it is that works for that individual. We need it all.
It's a phase of life issue, you know, it's a difficult phase of life, but it's one that if there's a little bit of targeted intervention at the right time, and it's the kind of intervention that makes sense out there, then, you know, vets come out on the other side just as successful as they were in the military.
The number one thing is we need to adequately fund mental health services.
The intervention needs to be smart. You know, we can't just throw dollars at it and expect it to be successful. We have to be, you know, coordinate our resources and apply those interventions strategically.
It's the education and awareness within the veterans and the community. It's training and educating Lufkin on veteran issues and the veterans within their community and the veterans within there. It's Tyler. It's that local level, how they can do it.
I do encourage that we stay focused on very concrete projects.
You know, we train for the purpose of them starting peer groups. The whole purpose of peer support is to inspire someone else's hope.
Being a counselor or going through the training, I'm able to say, it's going to be okay. They don't believe me, but you got to give them hope. You don't want me talking to them no more? Is that what it is? This is my heart.